Every Wednesday, right about this time, we have a wonderful doctor associated with Altus. Altus, choose well, choose Altus when it comes to the world of healthcare and medicine. So not only we have the doctor, we have an eye doctor here, Dr. My Eyes. She is joining us right now. She is out in my neck of the woods, out in the Sugarland area. Dr. Sana Malik. She's an OD, doctor of optometry. Is that just a professional way of saying an optometrist?
Yes, it is.
Well, just call yourself an optometrist.
That's what we do.
What's the difference, optometrist and ophthalmologist? I never figured that out.
So ophthalmologists do surgery. Optometrists do, regular eye exams. We screen for diabetes, high blood pressure. If we see anything that needs any surgical, if they need surgery, we will refer them out to an ophthalmologist.
So you're an optometrist, so you cannot do surgery. You would then take us to an ophthalmologist.
Correct.
Now, at one point, would you like to be an ophthalmologist, or you said, "No, I don't want to jack with any of that stuff"?
I don't want to mess with that.
Okay. Well, who makes more money? That's what I want to know. Because my kids may want to be doctors. Which should they go after? Everybody needs eye care. Come on, I just got to put them in that industry. You're doing fine right now. I think she's
great.
She is. Advances in eye care. We're going to talk a few minutes about that. Pro Optics Eye Care. PROOPTIX. ProOpticsEyeCare.com is the website. Something that almost everybody needs. Everybody needs at some point. And as you get older, I'm not going to throw out my age or anything as I continue to get older, but my eyesight, Are you actually sitting there? Because I think you're 3 feet away from me. You actually look 8 feet away.
I think you need to
I don't know
make
if you brought an eye
appointment.
chart in. Give me the services you offer at Pro Optics.
So there's an array of services that we offer at Pro Optics Eye Care. We do full medical eye exams that include a full dilated exam where we look into the back of the eye. We test for glaucoma, macular degeneration, diabetes, high blood pressure, retinal detachments, cataracts, much more. We also offer pediatric eye exams, including little toddlers. We do dry eye testing, glaucoma workups. We offer surgical treatments like LASIK, Intacs for keratoconus patients, and cataract surgery. And of course, we do glasses and contacts also.
How difficult it is to look in little kids' eyes? Because I've never heard of a pediatric optometrist. But is it? I mean, those kids must be squirming. Do you have like this strap for their head to get?
No, they're pretty good. I mean, you have to entertain them while they're in your chair, but they're pretty good.
Do kids need to get their eye checked?
Yes, definitely. I mean,
At how old?
Before the age of 5. It's very, very important to get kids tested early, to diagnose lazy eye. If they have something like that, it needs to be diagnosed very, very early in order for it to be treated properly.
You still dilate eyes. Is technology not advanced as I was a kid to putting those eye drops in, and then you have to walk around with those nasty sunglasses like I did back in the 70s? Have you progressed any?
Yes, they do. We do offer photos, but it's still much, much accurate to do a dilation and take a look at the back of the eye.
Ugh. I guess I'm going to have to get it done if I want the top to bottom one. Dr. Sana Malik, she's joining me. She's with Pro Optics Eye Care out in the Sugarland area. Give me some other reasons people would go to the eye doctor, apart from getting glasses or contact lenses.
So we, dilating the eyes, we look at the back, we look at the blood vessels, make sure there's no leakage from diabetes, high blood pressure. We look at the optic nerve. We want to make sure there's no signs of glaucoma. We look for signs of fluid in the back of the eye. A lot of these things are, there's no symptoms.
Yeah, I was going to ask you that, because if all of a sudden I'm getting headaches or something like that, I usually go to, but this is why it's just a regular check. You need checkups because you may be walking around with something we don't know about.
And you would have no idea until we take a look in the back of the eye.
It obviously is the case. If you catch it sooner, it's much better than later.
Exactly.
Sometimes maybe you can correct it with some sort of a procedure, glasses, versus then you may have to do some sort of a surgery.
Exactly.
All right. I need to make an appointment with you ASAP. LASIK. Let's talk about LASIK. I hear a lot about it improves eyesight. You said you're an optometrist. Does Pro Optics perform this type of surgery, and what is it, and actually how can it help?
So LASIK is for those people that don't want to be in glasses or contacts. Most people after LASIK surgery see 20/20 or better. We do offer LASIK at Pro Optics Eye Care. We offer LASIK consultations at no charge for our patients. We have an ophthalmologist on board, Dr. Carlos Manrique, who specializes in blade-free Z-LASIK surgery. With this technology, our patients are corrected in as little as 12 seconds. Downtime for surgery patients is anywhere between 4 to 6 hours, and people are usually driving and working or doing physical activities as soon as the next day.
The next day, which is good. A lot of people are shaky and they freaked out because I've actually been in kind of the waiting room where there's video monitors that you can see. It surprises how quickly it's done. I mean, it is over in a matter of seconds.
Very quick.
You have to calm down some people. I recommend bourbon. I don't know if you give people anything else.
No, we don't give bourbon, but
well, I'm not going there.
It's very safe and it's a very quick procedure.
Dr. Sana Malik, she is an OD doctor of optometry at Pro Optics Eye Care. What would you recommend to people to take better care of their eyesight? Bottom line, it's just, we take care of our heart, we take care of many other things. How do you take care of eyesight? Just the general topics.
So basically, you want to make sure you're getting a dilated eye exam every single year so we can take a look at what's going on back there. Very important for people who have a history of eye diseases in the family to have a comprehensive dilated exam. Things like macular degeneration and glaucoma, they're hereditary, so people want to be proactive in getting tested for them. And early detection is really key. Good UV protection. You're here out in Texas, the sun is just blazing out there. You want to make sure you have a good pair of sunglasses to help protect from the UV rays. For those computer users, who are staring at a computer screen for 8 hours a day, I follow the 20-20-20 rule. So, for every 20 minutes that you're on a computer screen, you want to take 20 seconds, look at something 20 feet away. Give your eyes a break. Your eyes are not supposed to be staring at a screen all day long.
I like that, 20-20-20.
20-20-20.
It's not that you have 20-20 vision. You just the 20-20-20 rule. It's a good point. It's good something to live by.
Another thing, early detection in kids, you want to make sure you're getting them in before the age of 5 because, if they have anything like a lazy eye, it's very hard to treat that after the age of 5. So really, get the kids in. You want, even though they're having school screenings at school and they pass, it does not mean that, they don't have any issues going on. School screenings do not test for lazy eye. They do not test for other ocular diseases. They need to come in for a full dilated exam.
Good. Now I'm pulling my kids out of school. You're giving me some great advice over here, so I got to come to you. One more question before we get you out of here. This Pro Optics Eye Care, it's kind of a family business over too. I believe your sister, there's another Dr. Malik. I mean, your parents must be pretty proud. My goodness.
There's actually 3 of us.
Oh, my goodness. You have a 4th one who's a bum or something? Because we've got a complex at that point. Syra Malik, I think is her name. Dr. Syra Malik. She practices with you. You have a new office in Sugar Land, which is very convenient to get to. Tell us exactly where it is if people want to make an appointment. What's going on there?
Yep. So my sister and I are partners at Pro Optics Eye Care. We opened our office in Sugar Land about a year ago, and it's right next to Town Center, across from First Colony Mall. We're really excited to be there. Really appreciate the support that our patients have given us. We love serving the Sugar Land community for all their eye care needs. We're growing. We're expanding. We take pride in offering a full one-stop shop eye care center for our patients. And whether it's contacts, glasses, LASIK, anything that you need, that's we offer it.
It's Pro Optics Eye Care. How about the phone number if anybody wants to give you a shout? What is it?
It's 281-242-1331. We're located at 16103 Lexington Boulevard. Like I said, right across from First Colony Mall, right beside Town Center. Town
Square. Very quickly, right off of Highway 59 and Highway 6.
Right.
It's simple. All right, real quick before we let you go, all right? Here's a little eye test. How many fingers am I holding up?
5.
Uh-oh. You need to come into my office, sister. And it's 2, and it's the pointer, and it's the pinky. Hook 'em horns, as we say here on the Michael Garfield Show. Thank you so much, Dr. Sana Malik. She is with Pro Optics Eye Care, part of the Altus Health Day. Great partners in Altus. We appreciate all their doctors coming in, calling in every single Wednesday. We're going to put a link to Pro Optics Eye Care along with Altus, which we have on my blog, which is at v950.com. I'm calling your office. I know the number now because I'll see you. Don't tell people about my eye. HIPAA. You can't tell people how bad my eyes are, but you will fix me.
I will fix you.